Hi, my name is Dale Abel. I'm chair of the Department of Internal Medicine here at the University of Iowa, Carver College of Medicine. And we are having a appropriately socially distanced conversation with two of the key leaders in our Internal Medicine Residency program. On my right is Dr. Manish Suneja, who is the program director for our Internal Medicine Residency Program. And on my left is Dr. David Stoltz, who directs our Physician Scientist training program. We're having this conversation with you today because given the reality of the current pandemic, we can't actually have this talk with you in person. So we're sending you a little bit of a recording of our thoughts so you can have an understanding of our philosophy around training here at the University of Iowa. What would you say is our general philosophy around the way in which we approach house staff training here in internal medicine?
Thank you, Dr. Abel. One of my biggest philosophies in teaching is that we actually not just focus on knowledge acquisition, but focus on the underlying principles of scientific inquiry. So what is really important for me is that we just don't know about the clinical presentation, but also teach our learners the first level of why, the second level of why, and at least the third level of why. And for me, it's of course, smarts is not what just makes an amazing physician. It's a combination of both humanism and this intellectual curiosity, this scientific inquiry. So it has to come, both of these two factors need to come together to make a great internist or a great physician at the end of 3 years or end of 6 years of training. So that would be the underlying philosophy which I have in my head when I'm designing programs, when we are coming up with innovations in the program.
So maybe if I can restate what I think you just said, Manish, is that we recruit very talented trainees, because you said it was not only about smarts, but I will say that we have amazing trainees who come here. But I think you're also saying that our goal is to really create spectacular clinicians who have a lot of empathy and really are committed to, on the one hand, scholarship, on the one hand, clinical care, but also an individualization of their training experience, so that once they finish their training here, I would say they're a complete internist. How about that?
That is, it was very succinct. And, one of the other things when I'm looking for somebody to recruit to our program, I'm looking for a lot of humility. And humility is a really important element which we are looking in each and every applicant who comes and interviews at Iowa. And of course, I don't want my residents just to be lifelong learners of medicine. One of the other big philosophies which I really believe in is that they should be lifelong teachers of medicine as well.
That's a very good point. And so the other thing which I think is really important to convey about our view of internal medicine, which really speaks to a core value of our department, is the importance of scholarship and research. And just as Dr. Suneja said that we want to really promote curiosity, we also want to create an environment where our trainees can feel that they can have access to opportunities to do research. And in fact, we have a specific physician scientist training program that's led by Dr. Stoltz. And so perhaps, David, you can just give me a few words about why this is important for our department and your philosophy in terms of the kinds of people that we want to come here to Iowa to become physician scientists.
Sure. Thank you, Dr. Abel. And a real treat to be here with Dr. Suneja as well as Dr. Abel. Not everybody knows, but I was Dr. Suneja's chief resident.
That is true.
So
and
probably
you were a role model for me.
Probably not too surprising. I think we see eye to eye on a lot of our cores and values and beliefs. And,
so he came out okay then?
He came out okay, or I came out okay. But I think the fact that the three of us are here really shows the commitment of not only the residency program, but also the department to the training of physician scientists. So I've been the director of the physician scientist training program for about the past 2 years. I've been affiliated with it for about the past 7 or 8 years. And I really view the PSTP as a way to integrate the clinical residency training, the clinical subspecialty training, and then the postdoctoral research training, and really streamline that process and provide trainees with the opportunity where we can nurture and promote their success along this pathway. I think traditionally we've thought of MD PhD programs, and while a lot of people come out of MD PhD programs and be quite successful, unfortunately there is some rate of attrition. And I think our PSTP programs, one of its goals is to ensure that people who want to become successful physician scientists get what they need, the tools and the training to be able to do that. So in terms of trainees, we're training, I always say physician scientists. So the stuff that Manish said in terms of clinical residency training is as important as the scientific part. So we're looking for trainees with really good clinical skills and expertise and a commitment to caring for people with disease, but also people who are equally successful in the lab or in the clinical research.
So one of the points I think is also important to emphasize, and I say this to our training directors, both for our residency and our fellowships, is that every person that we recruit into our program is a potential future faculty member. We have learned over the years that when our trainees come to Iowa and actually get to understand the high quality of life here in Iowa City, in addition to the outstanding training that they get in clinical medicine, well, guess what? It turns out that most of them actually want to stay here as subspecialty fellows. I mean, last year we had a high water mark in that it was almost, 50% of our residents chose to stay in Iowa for their subspecialty training. And so we really view your recruitment here into our program as really forming the bench for the future of our department. And maybe I can ask you another question, David, in that regard. Perhaps you could give us a couple examples of residents who came here into our PSTP program who are not on the faculty. You don't necessarily have to call their names, but you can certainly, I'm sure you have some really
Sure,
good stories.
yeah, we have, first one that comes to mind is an assistant professor in the pulmonary division who's about probably 3 years out of the PSTP program, came here, did his internal medicine residency, took advantage of the ABIM research pathway, so did the 2 years of categorical residency, followed by his fellowship training, came on to faculty as assistant professor at the tenure track, roughly a year and a half ago received his K Award. Mm-hmm. So one of the things that I think at that stage of his career we see as a key metric of success, if you will, and is doing really well in the lab. A couple examples in cardiology of trainees who are maybe in their 4th year of cardiology fellowship who were in the process of recruiting onto the faculty.
Right.
And so, I think it's tough to look at the success of this type of program because it takes years. Our ultimate goal would obviously be to say that we've trained leaders in academic medicine who are division directors and department chairs and leaders in their respective field.
Which is true. So I would say that if you look at division chiefs and department chairs across the country, many of them, their path came through Iowa at some point. So I think you're being quite modest. Right. I think that is our aspiration. And
including the president of the AAMC.
Exactly.
And one of our division directors, Dr. Chalong, he did his residency here and he did his training here. So I think we got to take credit for that too.
Exactly. So, some people say that Iowa is flyover country. Of course, we disagree with that, of course. But with that said, talk to me a little bit about this notion that if you come to train here in a rural state, in a small college town, will they get enough medicine?
Oh yes, without any hesitation, I can tell you, we see the toughest cases, we see the most challenging cases, and again, our catchment area is so huge. It's not only just Iowa, parts of Wisconsin, parts of Illinois. So we are actually getting the toughest cases with astounding, amount of complexity. And I can really, without any hesitation, promise you at the end of 3 years, our residents are trained to take care of these patients with amazing skills. And when we actually graduate them, they can actually manage the toughest patients without any hesitation.
Yeah, this is a really important point to emphasize because I also go around and do rounds weekly with one of the teams, and I am always just blown away by the complexity of the cases that we see, including things like malaria. That you never think, how could malaria come to Iowa? But it does.
It does.
It does. And so, I think it's a very important point that as the only tertiary academic medical center in a state with a population of more than 3 million, and then with the borders coming into our orbit as well, we actually are seeing a much larger referral base than many of our peers in large cities that have multiple medical centers that are now competing to take care of patients. So I think this is a very important point that should be emphasized. So let's pivot back to research a little bit, because I think that one of the things that individuals coming here are considering our PSDP program will ask is, how involved are the faculty in research? How involved are they in terms of mentoring? How easy is it for them to go and talk to a faculty member as a potential mentor? So maybe you could speak a little bit about that so that those watching this video will have an understanding as what that might be.
Right, yeah. And, that was, I think, one of the first things that struck me when I came here to interview for residency is how easy people were to talk to and how welcoming. I can remember knocking on people's door, walking in and unannounced, and, tell them you want to chat about what they're doing in the lab. And so I think that's an incredible asset here and something that's really easy to accomplish. And even on the wards, I'm on call in the ICU at night, talking to the fellows, and they say, "What do you do in the lab?" And, we spend as much time talking about what I'm doing in the lab as the patients we're caring for that night. And so I think that is, I think, a really positive attribute of training here. So I think there's opportunities on the wards where you can talk to faculty, but I think you can also just pop into people's labs and chat with them as well. Right. And I think that spans the range of basic science all the way up to, translational and clinical opportunities. I think there's a real breadth of opportunities in terms of tailoring people's interests and expertise to the types of research projects and programs that they want to develop.
Right. No, I think you're so right. In fact, what resonates with me, particularly recently, is that if you follow our chief medical residents on Twitter, they actually tweet out the publications of the trainees. Right. We celebrate every paper, and particularly when the papers are written by our residents and our fellows. So I think that does speak to the culture of weaving research into our clinical mission. The other thing I can say is that I surveyed earlier this year all the faculty in terms of what their aspirations were for the department going forward. And what was really remarkable to me amongst the individuals who would self-identify as clinical faculty, that they put research as a very important goal that they had as clinicians here at Iowa, because they recognize how important that is to our mission. And in fact, they wanted more involvement, with activities to do research. And so I think really, an important message that I'm hoping that this conversation will convey is that you come here to Iowa, you get the full package. In other words, not only are we providing outstanding clinical training, not only are we training our host staff to be educators, but we are also really exposing our trainees to an environment of curiosity, really with a goal of seeking new knowledge.
And Dr. Abel, one of the things which I see from a lot of our alumni surveys is again, this point about mentoring. And the big thing about Iowa is that you and your mentor are exactly at the same level. That is what makes the whole difference that it is. I think my trainees are not afraid of asking the tough questions. They're not afraid of actually speaking their mind out because they know that it is going to be a two-way street. And this is where I think, great questions come from, great hypothesis comes from, because they are, they're exactly at the same level. And one of the things which I've emphasized over the last, 15 or 18 years of being here is that you don't have to think twice before you ask a question from your mentor, because this is a place which is welcoming, and it's just all about the personal relationships with your mentors. It's just not just being in the same lab or just being a clinical mentor or being, mentoring on the side. It's just you are actually a lifelong friend.
Sure.
And that's what Iowa brings, which is kind of a little different than a lot of other places which I've been to and I've experienced.
So I want to follow up on that thought, because I think, you're already beginning to describe here a esprit de corps amongst faculty, amongst trainees. And, again, one of the things that we oftentimes look forward to in recruiting season is to have our interviewees here in Iowa City to actually interact with our host staff to kind of understand really the tremendous sense of camaraderie that exists amongst the trainees. But the question I'm going to ask you to comment on, Manish, is, we have had an incredible last 6 or 7 months with this COVID-19 pandemic, which has really put a lot of stress on the system, on the health system, on resources, on people's time, and so forth. And yet, when I walk on the units and on the wards, really, I see a passion and a commitment to do the best. But maybe you can speak to us a little bit about the interactions amongst the trainees and the extent to which they take care of each other.
As you said, one of our biggest strengths is camaraderie. And this is what I call as, yes, it is a highly ranked, and a lot of people have heard me say that, yes, it's a highly ranked university-based academic center. But at the core of this program is it runs exactly like a community-based program. And what I mean by this is you'll have all the resources what a university-based program has to offer, but everyone is connected. I'm very fond of saying this is a place where Dr. Stoltz and I wouldn't be looking at somebody's name badges trying to figure out who they are. Everyone knows who they are, what their career aspirations are, what their goals are. And this is a place where you need help. There'll be 10 people volunteering, even if you don't need help. There's kind of like, sometimes you have to refuse help. But that, just sense of people offering help makes you feel like you're part of a family rather than working in a hospital or, passing your 3 years of your time in a residency program. So I can tell you people come from pretty much all over the country to our program, but once they leave this program, they're part of one big Hawkeye family.
Yes, one big Hawkeye family. So just to maybe have another perspective on research. So I know that, David, you are a world leader in the area of cystic fibrosis research, and it's been really an amazing example of going from a patient and their needs and taking questions into the lab. And I think that when individuals come here to train, they oftentimes are wondering, how do they take an observation in the clinic and move it into the lab and back again to the clinic? And so perhaps you could talk to us a little bit about ways in which here at Iowa we encourage that, and some of the examples in which we have been successful.
Sure. Yeah, no, I think that's really important, because at the end of the day, our ultimate goal is to improve the lives of individuals, right, regardless of what illness they have. And I think there's multiple examples of that happening at the University of Iowa, and it happening extremely well. So I'll give you an example that's sort of personal to me. So I'm fortunate where both my clinical service is related to cystic fibrosis, as well as my lab-based research is related to cystic fibrosis. And so, I can see somebody in the hospital, why do they have that particular infection? Why can't we get rid of it? Why are they having this symptom? And then you begin to think, okay, what might I be able to do in the lab to better understand that? So specifically for cystic fibrosis, we have taken observations that we've developed in our animal models of cystic fibrosis. We have confirmed those observations in people with CF and are now in the process of doing clinical trials using those ideas that we developed in the animal models to now bring new translational therapeutics to people with CF. And then we go back and forth, right? We may see something in people that we want to say, okay, we don't quite understand that, and now I want to go back to the bench and understand it better. And I think in an environment where people are so willing to help you and go out of the way to, maybe we've never done this before. It's not, no, we're not going to do it. It's how can I help you figure out how to do it? And I think as a trainee, that's really important because you need the resources, you need the support, and you need the people who are willing to go the extra mile to help you achieve, research success.
Yeah.
So I think that's one example of how that can be done. There are many other examples. The Diabetes Research Center, the Neuroscience Institute is doing lots of imaging where they're, doing research-based imaging in people with various neurologic disorders and such.
Right. And so just last week we had our departmental research day, and because of the pandemic, we had to do it virtually. But what I noticed, because I always go to the bottom of that Zoom thing and see how many participants are there. And what I can tell you is that people found the time. At the peak attendance, we were well over 150 people, listening to talks. And then we had a breakout session where we had 6 parallel sessions going, and the average attendance in the session was between 20 to 25 people. And so, this really spoke to me that there is this sort of significant interest in really hearing and understanding what's happening here in the research realm. I mean, the other area that I think we have also had tremendous exposure is in the area of quality and safety, because I know just last week now, I suppose, there was also the Midwest SGIM, Society for General Internal Medicine meeting. And I think there was a session that was pretty much all Hawkeye in the end.
It was all Hawkeye.
When all our residents were pretty much almost uniform in that session across the entire Midwest.
That's true.
Giving podium talks for their work in quality and safety. So maybe you can talk a little bit about that, Manish, and perhaps also that one of our chief residents is each year assigned as the chief resident who focuses on quality and safety.
So we have a chief resident who's assigned to quality and safety. We have a chief resident along with an associate program director who's responsible for mentoring and making sure that we have research and scholarship at the right track. And hopefully, this way we can actually maintain an upward trajectory rather than just doing the same thing. So we are actually thinking outside the box. We've actually moved into more and more publishing. So it's just not just presenting at regional, national, international meetings. Now our focus is on converting some of these innovations into papers. And, what Dr. Stoltz was just mentioning, I firmly believe that, even a curiosity driven by a single patient with unexplained findings can lead to amazing insights into pathophysiology of certain diseases. And I know in the academic world, sometimes case reports have a very a small impact factor, but in my clinical reasoning and diagnostic reasoning world, I think, if one case is providing an amazing insight into the mechanisms and bringing both, patient care, our mission for discovery and quality and safety, everything together, I think it has a huge impact factor, so we are actually focusing a lot on making sure that some of these patient scenarios where we don't have answers to, we take a deeper dive. And now we are actually making sure that our residents are publishing these case reports. And of course, our residents are publishing big studies. They're first authors on studies published in JAMA. They have papers being published in Circulation and other high impact journals. But I just wanted to bring the focus back on sometimes these case reports with unexplained findings and taking that deeper dive and asking that second level of why or third level of why, what I was mentioning earlier, is a huge program focus for me too.
But I wouldn't minimize those case reports at all, because in fact, and I blogged about this on
yes,
my
you did.
blog last
Thank
week,
you for doing
which
that.
is on Twitter, by the way, so you can follow me at Intimate Abel. So it turns out that I actually highlighted 2 papers by our residents that were in high impact factor journals, the leading journals in those respective subspecialties, right? And we've even had case reports in New England Journal of Medicine.
That's
right. So these are high impact case reports. Right, because what they actually do is that they really underscores, not only just the complexity of the medicine that we take care of here, but also the thoughtfulness and the thought process by which we try to understand what is making this particular presentation of this disorder relatively, so unique. So, there's the wrap. There's a lot that we have to offer here, and we certainly hope that this conversation has just given you a flavor of really the level of leadership that you will experience as residents, whether in the categorical program or in our physician scientist training program, as you come and visit and interview with us here at the University of Iowa.